My next guest is Britt Ballinger. Britt is an associate member of the American College of Cardiology. She's also certified by the American Academy of Nurse Practitioners. She's worked for the International Heart Institute and for Medtronic Incorporated as a clinical specialist in cardiac rhythm management. She is now with St. Peter's Medical Group in Helena. Hi Britt, welcome.
Hi. Thanks for having me.
Thanks for being here. So let's start out a little bit talking about, we talked a little bit about hidden hints today and what your heart may be telling you to indicate that you have potential problems. But what are some other risk factors? I mean, specifically, can you talk about family history and go into that a little bit about a potential for indicating you might have a heart, issues with your heart?
Family history is unfortunately the one thing that we can't do anything about, so we can't pick our parents. But
yes.
What that means is if you have a first-degree relative, a mother, father, sister, or brother who has had heart disease, for women under the age of 65 and for men under the age of 55, that means that your family history is positive for premature coronary disease, and that is a risk factor for you. So then you just need to be more aware and proactive.
So that's really something you need to make sure you share with your provider when you go to have a medical checkup. That's obviously very valuable.
Right, yes.
So what are some other indicators that heart disease might be in your future other than family history, which we don't have any control over?
Well, there's a lot of things that we can actually do things about. Number one thing is smoking. If you smoke, quit. You can't. Smoking raises your risk for every disease, especially heart disease and stroke. My mom was a smoker and she died at age 56. I think if she didn't smoke, she would still be here. So smoking is number one. The other thing you can do is exercise. I'd say anecdotally, if you took two identical twins and one did everything wrong, did smoking, diabetes, everything wrong, and the other one walked their dog and did everything wrong, the one who walked their dog will live longer. So exercise is very important, and it's recommended that you get, just for general health, that people get 30 minutes of regular physical activity most days of the week. And that doesn't mean that you need to go out there and do a marathon. Walking for 30 minutes is physical activity. I ask a lot of patients if they exercise and they say, well, I'm really busy at my job. That doesn't count. It has to be 30 minutes consecutively. You can divide it up. It can be 15 minutes in the morning and 15 minutes at night, but 30 minutes of sustained physical activity where your heart rate gets up a little bit is what's recommended. The other thing that I run into with patients a lot is they find a lot of excuses that they can't exercise. And if you have, some people have bad knees. If you have bad knees, you need to find a way to exercise. If you need a knee replacement, get the knee replacement. If you can't walk, do a water aerobics class. So you'll live longer if you keep moving. So, and on that vein, being overweight is also a big risk for cardiovascular disease. So diet is important there. The most successful diet program is Weight Watchers, and studies have shown that any diet program where people record what they eat is the most successful. So they have a lot of online diet trackers out there. I have one on my smartphone. They have a huge database of food. It records calories, carbs, sodium, and you can scan them with your phone. They're really easy to use, and it keeps you accountable. If you have diabetes, just make sure you work with your doctor to keep it in good control. If you have diabetes and it's out of control, then your risk for cardiovascular disease is way higher. So it's really important for diabetics to keep their sugars in control. Same with high blood pressure. And these two things also relate to family history. You can acquire diabetes with weight, but a lot of times it's genetic, and same with blood pressure. Blood pressure does go up as we age, but since we live so long now, we still don't really accept those high numbers so that people can feel good longer. So it's important for people to work with their doctor to keep their blood pressure in good control.
Great. Stress, how about that?
Stress management is huge. I mean, there's a lot of studies that show people, those type A people are more prone to cardiovascular disease. So techniques, they're doing a lot of studies with meditation to improve cardiovascular outcomes, yoga, exercise, laughter, taking a hot bath, just if you have a situation in your life that's causing you stress, find ways to mitigate it.
Thank you. You talked a little bit about your mom, and she potentially had a silent heart attack. Can you elaborate a little bit on what that means?
So what she died of was really a stroke, but when she came to the ER and they were checking her out for her stroke, they did an EKG, and it showed evidence that she may have had a heart attack at some point, probably way prior to the stroke. So a silent heart attack is one that occurs without you knowing about it, but then they can find evidence on an EKG or echocardiogram. In her case, her stroke was pretty severe. She lost the use of the left side of her body and the right side of her brain. So kind of since the heart attack had already happened, the stroke was more of the focus. So there was nothing to be done about it in her case.
Hey, we have about a minute left. Can you think of common complaints or symptoms that might make you suspicious of heart disease in 30 seconds or so?
Oh, I'll try. When someone says, it's not really pain, it's pressure, I get suspicious. Or any symptoms that people have waist up that go away with exercise make me a little suspicious. Shortness of breath is a big one, chest pressure is a big one, fatigue is a big one, palpitations can indicate a problem. It's just a good idea to check in with your doctor if you're having that stuff, especially if it goes with exertion.
Great. Well, I want to thank you for all that great information. I'm sure our viewers will appreciate that. So thanks for being here.
Yeah, thanks for having me.
You bet. Looks like we're about out of time. So I want to thank again my guests and to remind you at home to stay well, stay fit, and stay healthy with Healthy Living for Life. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.